Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.
Mold, it's everywhere. In our yards, in our homes, on our food, and yes, even on our skin. But when does mold become a health issue for you and your children? Take a look. Mold is a fungus. By definition, it provides a superficial growth on various kinds of damp or decaying organic matter.
Whether it be wet drywall, which has paper coating, which is from plants, or whether it be the wood structure of a residence.
Just as plants release seeds that become airborne, Chris says many molds also release seeds known as spores. Every breath of air we inhale 24 hours a day, we're taking in mold spores. They're everywhere.
We've evolved to live around mold spores. Just their mere presence doesn't indicate that it's an imminent health threat.
Certified Industrial Hygienist Dr. Chris Tennant of San Joaquin Environmental says the scientific consensus right now is that mold spores in the air can cause allergy-type symptoms.
There is no scientific evidence that it causes any other health effect. It's been linked to autoimmune disorders, memory loss, hair loss. The list is endless, but when you really look at the scientific evidence, it's really not supported.
Dr. Praveen Badega of Boz Allergy, Asthma, and Sinus Center in Fresno agrees with caution.
It can cause health problems in those who are sensitized to mold, and the problem that usually causes is in those who are allergic to it in terms of sneezing, itchy eyes, runny nose, sinus congestion, nasal congestion, and if that progresses, it can turn out to be a respiratory problem like difficulty breathing.
There are basically 3 distinct levels of mold.
A level 1 situation is it's a small amount of mold, which you could clean up yourself using basic housekeeping methodologies. Level 2, which is a little more in-depth level of cleaning.
And level 3 is the most serious.
Level 3 would necessitate bringing in outside experts, which have the necessary expertise to make sure that the cleanup is done correctly and the small mold spores are not disseminated to the rest of the building.
Dr. Badega says the first course of action in a level 3 would be to seek professional health care advice and remove the mold.
If it's a large area of mold, then during the process of remediation or the removal, the person with the existing health condition or the child should be taken out of the home, at least during the remediation process.
If you notice mold in your home, don't hit the panic button, but be mindful of the young.
As kids and young adults, we're more susceptible because our immune system is growing up. And if we're immune compromised, if we have an infection, we have more susceptibility to those particular molds.
Prevention is key. Here are a few tips.
To maintain the humidity between 40 to 60% in the home, have the air conditioner on, or if they have a dehumidifier, to use a dehumidifier.
Next, be vigilant.
If you notice mold growth, then don't just cover it over, clean it up. Look to what is the cause of the moisture in the first place and correct that as well as clean up the mold.
Be sure to open a window and always turn on the bathroom fan.
If you don't have a window to open and ventilate a bathroom where there's a lot of humidity, a lot of moisture, then you're going to create a mold problem.
We want to decrease that burden and load. So once you see mold growth, you know it's there. The only thing we can do from our end is control and removal.
And for more about California's mold guidelines, just go to our website at kvpt.org, then click on 0 to 5 in 30 minutes.
Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.